Hello, I'm Dr. Cherry Bernardo-Lazaro. In this lecture, I will be talking about one of the fundamental principles in public health and in primary health care, which is health as a human right. These are the expected outcomes for this lecture. Before we can discuss the right to health, we have to first define human rights. And what comes to mind is the Universal Declaration of Human Rights of the United Nations, crafted in 1948 or after World War II. Before we touch on the said document, it would be worth looking at the definition of human rights or human rights. What is it or what are they? Human rights are said to be basic rights and freedoms that belong to every person in the world from birth until death. Therefore, they apply to each one of us, regardless of race, religion, and way of life. These basic rights are based on shared values such as dignity, fairness, equality, and respect, and independence, which are values defined and protected by law. Thus, nobody can take this away from you unless, of course, you break the law. So, what are our human rights? There are 30 articles stating these rights based on the Universal Declaration of Human Rights. I won't go through all of them one by one, but allow me to simply organize these rights into three categories. First category is the civil and political rights, which include a right to vote, own properties, or to free speech. Sometimes these laws are pertained to as negative rights. International laws are made to make sure that these individual rights are not violated. The second category is the economic, social, and cultural rights, which include the right to education, shelter, employment, and security. These rights are sometimes pertained to as positive rights, as different countries or member states or governments shall ensure that domestic laws and interventions are in place to ensure that these rights are realized. The third category is the collective or solidarity rights, which include the right to organize as a group, practice certain culture, right to self-determination and empowerment. Right to clean air and healthy environment are sometimes included here. Some would pertain to these rights as green rights. Question is, if civil and political rights are under international laws and economic, social, and cultural rights are under the governments, who take care of collective and solidarity rights? Looking back at the previous table shown, under what category and dimension is the right to health? Think about it. Article 25 of the Universal Declaration of Human Rights states that everyone has the right to a standard of living adequate for health and well-being of himself and his family. And if you read further, it also states conditions needed to uphold this right. So, what is the right to health? If you have time, you can go through this document by the United Nations and the World Health Organization. While very old, most of the content still hold true, and this is what we'll try to elaborate. One of the first lessons that we probably learned in medical school is the definition of health. And this definition was reiterated in the 1946 WHO Constitution, which also states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, and social condition. It should be clarified that the right to health is not simply the right to be healthy or the right to health care. There are two key elements in the right to health: accountability and participation. Member states who are signatories to the international human rights treaties are accountable to fulfill the obligations under the right to health. At the same time, people, citizens, and communities in the member state should participate and be involved in contributing to better health and delivery of health services. And when we talk about health services, they shall adhere to the four essential standards of healthcare services, which the right to health imposes, and these are availability, accessibility, acceptability, and quality. Among these four essential standards, the standard on accessibility seems to have overlapping dimensions with the other standards, because in a way, when we talk about accessibility of health services and facilities, they should be non-discriminatory or accessible to all, including most vulnerable. They must be within safe physical reach to all parts of the population. They should be affordable, and they should be able to impart information regarding health issues. How about the key aspects of the right to health? The right to health is an inclusive right. Therefore, it does not only include healthcare facilities and services, but also the underlying determinants of health, which include food and drinking water, housing, working conditions, education, and equality. The right to health also includes entitlements such as right to a system of health protection, access to essential medicines, basic health services, and entitlement to participate in health-related decision making. Finally, the right to health includes freedoms such as the right to be free from non-consensual medical treatment. That's why you have to do informed consent, whether in research or in medical interventions, and freedom from torture and other cruel, inhuman, and degrading treatment or punishment. Moving on, health professionals working with the right to health also need to be familiar with the obligations that the right imposes on governments. The right to health, like most human rights, imposes three levels of obligations on governments. These are the obligations to respect, or government itself does not interfere with the enjoyment of the right to health, to protect or make sure that third parties do not infringe on this right, and to fulfill or takes positive steps to realize it. Under the obligation to respect right to health, states should refrain from denying or limiting access to healthcare services. Examples are marketing of unsafe drugs, imposing discriminatory practice relating to women's status and needs, limiting access to contraceptives and other means of maintaining sexual health and reproductive health, withholding, censoring, or misrepresenting health information, and infringing on the right to privacy, such as in persons living with HIV or AIDS. So if you'll reflect on it, is our government respecting right to health? Are there any of the or are any of the healthcare services mentioned denied in our country? Now, the obligation to protect requires governments to prevent third parties from interfering with the right to health, which include adopting legislation and other measures to ensure that private actors conform with human rights standards when providing healthcare or other services. Examples are regulating the composition of food products, setting appropriate controls on marketing of medical equipment and medicines by private actor. Maybe an example of this is the Mexico Protocol for drug companies. Not sure if you heard about that, but somehow after that, sponsorships of medical doctors as part of marketing has been limited. Another one is ensuring that privatization does not constitute a threat to the availability, accessibility, acceptability, and quality of healthcare facilities, goods, and services. So, if you remember, some groups are against privatization of some government hospitals. Another one is protecting individuals by acts by third parties that may be harmful to their right. Example is preventing women from undergoing female genital mutilation, such as in some countries. Ensuring third parties do not limit people's access to health related information services, including environmental health, and finally, ensuring that health professionals provide care to persons with disabilities with their free and informed consent. That's why we have ethical standards, patent research, and patient care. Thus, when negotiating international and multilateral agreements, government should take steps to ensure that these instruments do not have an adverse impact on the right to health, especially to its citizens. Finally, under the obligation to fulfill, governments are required to adopt appropriate legislative, administrative, budgetary, judicial, promotional, and other means to fully realize the right to health. Examples are adopting a national health policy or a national health plan covering both public and private sectors, ensuring the provision of healthcare, including immunization programs, ensuring equal access for all to the underlying determinants of health, such as safe and nutritious food, sanitation and clean water, ensuring that public health infrastructures provide for sexual and reproductive services, and providing information and counseling on health related issues such as HIV and AIDS, domestic violence, or the abuse of alcohol, drugs, and other harmful substances. Now, these are examples of fulfilling right to health. Furthermore, it is said that having an effective and integrated health systems encompassing healthcare and underlying determinants of health are also key to ensuring the right to health to the highest attainable standard of health. So, to reiterate, under the right to health, governments have the obligation to 1. Ensure that they are not violating the right to health, that is respect. 2. That others are not violating the right to health, that is protect. And lastly, they are doing something to ensure the right to health, that is fulfill. Got these? Okay, good. So just to review, which obligation in right to health is not done or observed in the given cases. So you choose among obligation to respect, to protect, or to fulfill. Okay. Um, when prisoners one if when prisoners are not given proper medical attention. Two, if health education programs are withheld in a government hospitals. Three, if a pain reliever drug that was pulled out internationally due to cases of myocardial infarction is allowed to be sold in the local market. And four, if pain medications for cancer are not distributed in healthcare facilities. I think these were part of the examples cited earlier, so just go through them again. Bitin ba? Anyway, for me, 1, 2, and 4 did not observe obligation to respect, while 3 is more under the obligation to protect. These are the references I used for this lecture. Let me end this lecture on health as a human right with this reflection question. In what instances or examples is health as a human right not upheld or violated? Maybe you can take a walk, look up, look down as you reflect on this. Thank you for listening.